Good evening. Thank you for joining ABCD After Breast Cancer Diagnosis for our May LEAP Speaker Series webinar. Our webinar will begin shortly. In the meantime, please take a few moments to learn more about ABCD and view some of our upcoming events. Thank you for joining us. So thank you all for joining us. My name is Keisha Jones. I am the Director of Healthcare and Community Partnerships for ABCD After Breast Cancer Diagnosis. And so welcome to our May LEAP series, which is focused on lymphedema, risk reduction, separating the myths and the facts. So we are just so excited to have you joining us all. As you know, ABCD, we are celebrating 25 years of offering free emotional support services from one trained breast cancer survivor to someone newly diagnosed or in survivorship. And so we're so appreciative to be able to offer these educational webinars for our ABCD community, just to keep you connected and just to allow you to continue learning about things that do impact those facing a breast cancer diagnosis. So without further ado, I'm going to turn it over to our Executive Director, Ellen Schupper, to go ahead and introduce our speaker.
Gosh, you would think I would know to unmute, so I apologize for that. So, hello, everyone. We are delighted to see so many faces, so many people here. My name is Ellen Freebird-Schupper. I'm the Executive Director of ABCD, and it's truly my honor to introduce the one and only Dr. Leslie Waltke. I do have her bio over here, which I'm going to read. She is a physical therapist with a clinical mastery in cancer care and recovery and is proud to lead the country's largest cancer rehabilitation program for Advocate Aurora Health, based here in Milwaukee, Wisconsin, which is where I'm located as well. She is the founder of the Recovery Room, an educational YouTube channel for cancer patients and survivors, and she serves as co-medical director for Team Phoenix, an Aurora Cancer Care Triathlon training program for women cancer survivors. She is respected nationally and internationally as an oncology physical therapist, key opinion leader, educator, and consultant, And she is one of the founding members and current members of ABCD's board of directors. So we are very honored to have her. She's awesome, amazing, and I know we're going to learn a lot from her this evening. Take it away, Leslie.
Well, thank you so much, Ellen, and thank you so much, Keisha, and to your planning board that put this all together. And I love that we have so many people on tonight. It's awesome. So welcome everyone from throw in the chat where you are from, because that's always fun to see. Thank you, Ellen, for that fantastic introduction. Again, my favorite thing of that whole piece of paper is being a board member with ABCD currently, and have been proud to be part of the organization since its inception in 25 years ago. So a great opportunity to be here.
Yeah,
today.
and I'll see. It might not be anything. I don't know.
All right. So what we're going to talk about today is this is basically the goal here is to talk to people who are at risk. Okay. So if you have lymphedema, some of this will apply to you, some of it will not. So this is just so you know that this is for people at risk. So the topics we're going to cover is what is lymphedema. Let's define it first so we know what we're all talking about. Then we're going to talk about infection 101, because that's something that the lymphatic system does and can put you at risk for chronic swelling. So we'll talk about that. And then the just of this is going to be, okay, what can you do to minimize your risk? And that is definitely going to involve some myth busting. And then we're going to talk about good old exercise, because that, again, can substantially decrease your risk from developing lymphedema in several ways. All right. So let's take a peek at lymphedema, and let's just start by the definition here. So officially, lymphedema is a buildup of protein-rich fluid in the tissue causing swelling or hardness in a body part. Okay. What I first want to say is that when you see the word protein, people start thinking dietary protein. It is not dietary protein. We're talking about amino acids, fibrins, collagens, those kind of protein, the protein building blocks. So eating a protein-rich or protein-free diet does not impact your risk of getting lymphedema at all. So don't let that be confusing to you. Okay. But for those of you who do with lymphedema, or if you've seen people with lymphedema, and I'm going to show you a picture now. This is a friend of mine. You can see she's got a little bit of swelling in her right arm compared to her left arm. So she is living with lymphedema. So when you get extra fluid in your tissues, and I'll explain where this stuff is, you can actually see the limb be a little bit bigger. This, again, it can be the chest wall, it can be a leg, it can be the groin, it can be the arm. And also, you can sometimes in some swellings, you can actually push on it with your thumb and leave kind of a dent. That's called pitting edema. That is common with some lymphedemas, and that's from that protein component. And this will all make sense when I tell you what the lymphatic system does. So extra fluid makes it bigger, okay? And sometimes people get a thicker, firmer, or dentable fluid, and that is that protein content. Okay, so let's talk about the frequency of lymphedema. So for people who've had a standard axillary dissection, which can be anywhere from 10 to 30 lymph nodes removed from the underarm, the risk potential is around 15%. For people who've had just a sentinel lymph node biopsy and no axillary dissection, so you're looking at 1 or 2 or 3, maybe 4 or 5 nodes removed from the armpit, the risk is about 6%. For people who have had lymph nodes removed from the groin, and I'm assuming there's very few of you because this is a breast cancer group, the risk can be significantly higher, and it will really vary on what type of cancer you have. So if you've had lymph nodes removed from the groin, for some reason, you want to talk to your surgeon to kind of find out where you are on that risk scale, okay? Most lymphedemas, not all, happen in usually the first 1 to 3 years after the lymph node removal. It can happen sooner, but that's not super common. And it can certainly happen beyond that, but most of them, if you put them on a bell curve, are going to happen around between 1 and 3 years. So if you're somebody who's in the 15% group right now, after 3 to 5 years, this number will start to, it never goes down to 0 because we don't regrow lymph nodes. But the further you get away from the time of your surgery, the lower that risk goes a little bit. Okay. But technically, the risk is lifelong. So a couple things I want to talk about lymphedema is not all swellings are lymphedema. So if you have swelling, make sure that it gets diagnosed because some chemotherapy drugs can cause swelling. Cording, which is a condition in the arm, can cause swelling. Blood clots can cause swelling. Infections can cause swelling. So that's why we need you to get to a physician if you see something swelling so they can figure out where it's coming from. All right. Lymphedema can happen anywhere in the arm, the hand, or the fingers. It is possible to get lymphedema in one finger. Okay, not common, but that can happen. So it doesn't have to contain the whole arm to qualify as a diagnosis. Okay. And yes, you can get lymphedema in the breast. Another thing I want to point out is lymphedema itself should not be painful. Okay. Sometimes people, if they get really swollen or if it gets kind of firmer, they can say, wow, it's just really tight. It's really uncomfortable. It's kind of heavy. But it shouldn't be quote unquote painful. So if people are having pain and they have lymphedema, they might have a musculoskeletal problem, tightness, shortness, radiation fibrosis, weakness. Those are things that should be treated. Okay. Because people living with lymphedema should be pain-free, have full range of motion, have full strength, and be fully active. All right. Okay, so let's now quickly review the lymphatic system so we all kind of know what we're talking about. So the lymphatic system is a series of vessels found out through the entire body, has lymphatic system in it. And it's got a bunch of jobs, but in regards to what we're talking about today, lymphedema, it has several roles, but its main job is to take all the fluid underneath our skin and send it back to the heart. That's kind of its primary role. So here is a picture of, or a drawing at least, of the lymphatic system. And you can see that the lymphatic system is split into 4 parts. It is split at the line of the belly button. So everything from the belly button drains up. Everything from the belly button down drains into the groin. Everything on the left side of your midline drains to the left. Everything on the right drains to the right. So if you have had lymph nodes removed from your left underarm, you cannot get lymphedema in your right arm, or you cannot get lymphedema in your left leg, because it has its own unique lymphatic system, okay? Whoops, my apologies. So this is a drawing, but again, this is kind of a general idea now of how all these little vessels pick up the fluid and drain it back towards the heart. So lymph nodes then are little lima bean shaped things that are placed in groups throughout the lymphatic system. And one of their primary roles is to act as a filter. So as the fluid comes from the extremities back to the core and back to the heart, all of that fluid has to go through these lymph nodes, and those lymph nodes pull out anything that's not supposed to be there. So that includes broken cells, waste products, viruses, and cancer cells. So, and then the lymph node will trap it and then destroy it. So if there's always a positive spin on a positive lymph node, which people typically don't want, but the positive spin is your lymph node caught it, all right, and didn't let it go any further, and then typically destroyed it. So there are about 600 lymph nodes in the human body. The average human armpit, and again, this is average, there's a significant anatomical variation from person to person, but in general, the typical armpit has between 35 and 45 lymph nodes in it. And the groin has about 15 to 20 lymph nodes on each side, And up in the neck, we have about 160 lymph nodes. So this is why surgeons will typically remove lymph nodes around where your tumor is or where your tumor was. Because if those cancer cells are going to sneak away from that original tumor, they're going to sneak out through the lymphatic system. So the only way to really tell for sure if a lymph node has cancer in it is to take it out of the body and put it under a microscope. And unfortunately, we don't regrow them. So once we take them out, they're gone. Okay. But that's why surgeons will remove them in some cases, because that gives them a better idea of the stage of the cancer so they can create a better, more appropriate treatment plan for your particular cancer. So I want to now use the fancy word called interstitium that you can use with your family and friends later. The interstitium is the teeny little space that is between the skin and your muscle, right? We're talking a couple of microns in depth, okay? It's very little, but that's where your lymphatic system is, okay? And it is normal to have fluid in your interstitium. So as I mentioned, your lymphatic system does a bunch of amazing stuff, including building cells, creating immune cells, and actually moving the fluid around the body and protecting us from cancer, okay? When it comes specifically, again, to lymphedema risk, this is how the lymphatic system is impacted. So we'll talk about one of the things it does is, remember I said it can pull out viruses and bacteria. So the lymphatic system works as a defense system. It protects us from bacteria. The lymphatic system, the opening to the lymphatic system is bigger than the opening of our veins. So those protein molecules that we talked about, those amino acid building blocks, okay, those are too big to fit back into the veins. So they have to get picked up by the lymphatic system. So that's one of its jobs, is to pick up those big protein molecules. And then the lymphatic system helps maintain the fluid balance in that interstitial space, the interstitium. Okay, so remember, it's normal to have fluid there. So let's talk again a little bit more in depth about each one of those three things. So again, the lymphatic system removes bacteria, broken cells, cancer cells, waste products, anything that's not supposed to be in the interstitium. And then it picks it up, moves it along the system, filters it through the lymph nodes, all that stuff is pulled out. And then by the time all that fluid gets back to the heart, it's nice and clean. So here is why infection is important, because it puts an extra strain on your lymphatic system if you happen to get one in your body part that is impacted by the lymph node removal. So again, if you've had lymph nodes removed from your left arm or left underarm and you get an infection in your port, it's not on the right side, it's not going to impact your left lymphedema risk. Okay. If you get an infection in an implant on your right side and you have lymph nodes removed from the left, it's not going to bother your impact. If you get cellulitis in your right leg, it's not going to impact your lymphedema risk in your left arm. If you get a cellulitis in your left arm, that can impact your lymphedema risk because you're missing a few lymph nodes, and now they're having to kick into high gear to help protect you from that infection. So that's why infection 101 is important, okay? So cellulitis, when you hear itis at the end of something, that means infection. So cellulitis is an infection in the interstitium, or those interstitial cells. So that's cellulitis. The four primary signs for cellulitis include redness, warmth, pain, and increased swelling. So if you have any of those symptoms, sometimes you can just see redness. It doesn't necessarily swollen, it doesn't hurt, and it's not warm. I still want you to call either your physician or your nurse immediately, or call Ellen and she'll take you to urgent care with her son. But this is something that definitely needs to be addressed right away if it is in your impacted arm. Again, because it puts an extra strain on a lymphatic system that doesn't really need an extra strain. What they will most often do is give you an oral antibiotic to take to protect you or minimize the risk or get rid of that cellulitis in the arm. So next time you see your physician, your surgeon, just say, okay, who am I supposed to? Sometimes you don't hang on to your physician for more than a couple years. So I would say, who do you want me to call, or who should I call? Do I call my primary care doctor? Do I call my medical oncologist? But you should have in the back of your mind, who would I call if I needed to call somebody quickly?
And Dr. Leslie, we
Yep.
do have one question in the chat related
Yes.
to infection, so I'm going to let Amanda share that question if that's okay.
Please.
It looks like is it Cyrone has a question, wants to know if the lymph nodes acts as filters, does it make you more prone to infections and other illnesses?
It does not. It protects you. That's a smart thinking question. Because that's their role, is to collect that stuff so it doesn't make you sick, because it collects it and then destroys them. So it's a kind of a double system. So it collects things that aren't supposed to be there and destroys them, which is why sometimes if you have a lot of cancer, sometimes the lymph node will actually enlarge. Because there's so much cancer in there, it just doesn't let it out. And then sometimes it will get necrotic because all that cancer, those cancer cells die. But lymph nodes can also create immune protection cells. So they doubly protect us. It's a great question. Did that one come from Ireland by any chance?
No.
Okay. All right. So remember, we don't regrow lymph nodes. So normally, most of us have probably, unless we're in our 90s and stuck in a wheelchair, our parents sometimes when they get in those scenarios, they sometimes will get cellulitis in their legs just because circulation gets so poor. But for the majority of us, we've probably never had a cellulitis because our lymphatic systems typically work normally and they take care of things. But if you are missing 10, 15, 20, or 30% of your lymph nodes, sometimes a little teeny bacteria can sneak past the guard and create an infection where if you had a fully active lymphatic system, it wouldn't. So that's why people with lymph node removal are at increased risk for developing infections. Okay. So this doesn't mean you can't swim, you can't bike, you can't garden, you can't sew, you can't pick up your grandkids. It doesn't mean you can't do stuff like that or go hiking or whatever it is you enjoy. It just means, and again, my goodness, if you're human, you're probably going to at some point, scratch, break, scrape, burn your skin at some point. So when that does happen, okay, you want to keep it covered and moist until that area, keep it clean, keep it covered until that area is pretty much healed. All right. And you kind of know what's normal healing process. So if either just doesn't look right or doesn't seem to be responding well, or if it does get redder than you would like, that would warrant a call to either your primary physician or to one of your cancer docs. Okay. So now back to that little protein thingy. Remember those protein molecules, those little amino acid thingies? They have to get out of the interstitium somehow. They can either get picked up by the lymphatic system or they can get picked up by the veins. However, remember, they're too big to fit back into the vein, so they have to get picked up by the lymphatic system. So, unfortunately, those protein molecules, all right, are called hydrophilic. They love water. They absorb water. So if they start to collect in the interstitium, they can also start pulling in extra water, which can make them kind of problematic. And then finally, we talked about the lymphatic system acting as a primary tool in maintaining the fluid balance in your interstitium. Okay, so perfect example is the lovely state of Wisconsin. I think many of you live here in this state. Or those of you, it really doesn't matter where you live, but so if you go outside and it's 90 degrees outside and you walk to the car, you walk out to the mailbox, you walk around the block, you come back in the house and your rings are going to be, or your watch is going to be tight, right? Because your fingers swell in the heat. What's happening there, and that's totally normal. What happens is our lymphatic system, when our body gets too hot, we shunt automatically fluid to the extremities to try to cool us off. All right. So that's your lymphatic system in play. It's sending fluid to the extremities to cool you down. And then you go back inside the house, go back inside the air conditioning, and within 5 minutes, your rings fit normally again. That's the lymphatic system in action. Now, on the flip side, if you go outside and it's, 20 degrees outside, within a few minutes, your rings are going to be really loose. And now what's happening is your lymphatic system is taking that fluid from your extremities and bringing it to the core, your innards, to keep you warm. All right. So things are going to get really loose and sloppy. You go back inside, and within 5 to 10 minutes, your rings are going to be normal sized again. Okay. So that's a perfect example of how the lymphatic system maintains our fluid balance. Okay. Now, the veins will remove about 90% of the fluid from our interstitium, and the lymphatic system removes about 10% of the fluid from our interstitium. So that matters when we look at what's called fluid balance, right? Because we know that it normally goes up, normally goes down, and it's always kind of in this flux. So that fluid gets to the interstitium by the arteries, right? So our blood goes through the lungs, it goes through the heart, it fills up with nutrients, fills up with oxygen, and it gets sent all over the body. The nutrients, the oxygen, eke out of the arteries and into the interstitium. And then our bodies use up all the oxygen, use up all the nutrients. And then that fluid and waste products gets picked up by the lymphatic system and the venous system. So fluid balance, then, the amount that's brought in by the arteries has to be carried out by the veins and lymphatics. And as long as this is relatively in flux, things go up and things go down and everything seems to be working okay. However, if that lymphatic piece of the equation gets impaired a little bit, sometimes it can just throw off that balance just enough for some of that water, some of the fluid, and some of the protein to start accumulating in the interstitium. And that's when lymphedema can happen. So officially, what causes lymphedema is removal of lymph nodes during surgery. Okay. The lymphatic vessels in the skin can be damaged with radiation. And then obstruction of the lymphatics due to scar tissue. Now, number 1 and number 2, removal of lymph nodes and damage because of radiation, you and I can't change. A surgeon and radiation oncologist cannot change. They do their best to limit the amount of damage that happens with their treatment. All right. But once that happens, it's done. Obstruction of the lymphatics due to scar tissue, though, we definitely can improve that. Okay. So here is a drawing of the chest wall with the breast and the skin removed. So this is what your innards look like. So the people typically think that our armpit is kind of a benign, just smelly place. It's really actually pretty complicated. All right. So in this photograph, the skin is gone, breast is gone. And then this is the pectoralis major muscle that typically lays on top of the nerves, arteries, and lymphatic vessels that go down your arm. So when I ask as a physical therapist, people to stretch out, to move, to lengthen and strengthen, that's why good range of motion isn't good enough. It needs to be great. It's really important to stretch out and make sure all this stuff moves completely normally, so we're not adding extra compression onto a lymphatic system that doesn't really need to carry that extra load.
And
Okay.
Dr. Leslie, I think we
Yes.
have 2 additional questions that Amanda has for you from the chat.
Fire away.
All right. The first one is, do hot flashes overwork the lymphatic system?
They do not. They suck. But that does not impact the lymphatic system. So great question, but they still suck.
And then another one says, does lymph removal create a spacing or a gap in the area where it is removed?
It doesn't, because there's always going to be some there. Okay. It just can be higher than normal and then lower than normal, but there always will be some. just like your local river. There's always going to be water in there. Sometimes if it hasn't rained in a couple of months, it'll go down. When there's a lot of rain, it'll go up, but there's always some in there.
Okay. And then there is one more. Melanie says a friend who is an OT therapist suggested that she get lymphedema massage therapy to help with the swelling and nerve pain. She says, I do not have lymphedema per se, but she wanted me to help with the draining to lessen numbness, nerve pain, and tingling. Does this make sense to do?
Okay, so I'll quickly answer this and we can talk about it more at the end. If she is having nerve pain, she needs to talk, because that's completely separate than lymphedema. All right, so these are two different problems. So she definitely needs to have that evaluated by a PT and or her physician, because that's not normal. All right, so she needs to find out what's causing that discomfort. And I will tell you that, and we'll talk about myth busting, is that there is no evidence that for somebody who is at risk, that doing any kind of lymphedema massage is going to prevent anything from happening. Okay. It's also not going to cause a problem, because a lot of people will avoid getting massages, which you don't need to avoid, because there's no evidence it's going to create swelling. All right. And massage is wonderful. Okay. But if you are going to somebody and paying them extra money for lymphatic massage, there's no evidence that's going to decrease your risk. All right. Was that fairly clear? That person can come back at the end and I can spend more time on that.
Sounds good.
But if there's pain in that arm, she should have that evaluated, because that's not normal. Okay. So let's move on to the meat. How can you reduce your risk or minimize your risk? Okay. So the two biggest risk factors that precipitate the onset of a lymphedema are getting an infection, which is what we've already talked about. Okay. So minimize your risk of getting an infection. And the second one, unfortunately, is weight gain, because what happens to most people as they get older? And it's weight gain. All right. And weight gain is also attributed to many of the chemotherapy drugs that people are on. So, but these are the two biggest precipitators for lymphedema. The bonus is that they're somewhat both in our control. All right. It may not be 100%. I can't completely stop myself from gaining weight. I can't completely eliminate the risk of infection, but that's at least somewhat in our control. So here is the slide this is your take-home slide. All right. And we'll talk more about this, but these are the evidence-based, research-based ways to minimize your risk of getting lymphedema. Okay. And again, for most of you who've had lymph nodes only from your lymph node, this also holds true for anybody who's had lymph nodes removed in the groin. Okay. So the area around where your lymph nodes removed, we want you to restore that arm, shoulder, chest to 100% strength, range of motion, and tissue mobility. Okay, that's way number one. Number two is to minimize the risk of getting an infection in your involved limb. If you see something, act promptly. Okay. And then we obviously, again, want to either, if you are at a BMI that's in the range of normal, and again, it doesn't have to, there's no perfect body weight. There's an ideal range. Okay. If you are there, do your best to stay there. All right. And if you are above the ideal range, then slowly work towards moving your body mass index a little bit to a lower number over the next few years. And this isn't a class on weight loss and dieting, but I will tell you, ladies and gentlemen, the people that tell you that you can lose 20, 30 pounds in a week or a month or 6 months, it's not, if it was possible, we would all be doing it. It takes months or years of work and consistency to move your body weight. So just take some pressure off of your shoulders and just know that you're not doing something wrong. People are just telling you to expect too much. All right. And then a final way to minimize your risk is with regular exercise. Okay. So these are the proven ways to minimize your risk. Regular exercise, get to or maintain a healthier body weight, minimize your risk of getting an infection, and if you see something, acting promptly, and making sure that that particular arm is 100% strong, 100% has the shoulders got great range of motion, and it doesn't feel super tight. Now let's talk on several of those. They were kind of exercise based. So let's talk about why that is. So we've talked about the lymphatic system, and we now need to talk about how does the fluid and protein get from the interstitium into your lymphatic system. So those little openings are called initial lymphatic vessels. That's the opening is to the lymphatic system. And our circulatory system, our heart and our lungs, has a pump, right? It's got the heart that just continuously pumps. So when you are laying down, you are walking, your heart is constantly moving your arteries and your veins. The lymphatic system does not have that. It does not have a pump. So what moves those lymphatic vessels to open and close and therefore draw fluid into the system is muscle contractions, movement of the body part, increased breathing rate, and increased heart rate. These are the things that absorb fluid into your lymphatic system and move lymphatic fluid. So what does this scream of? This screams of exercise. So exercise is proven to be fantastically wonderful for your lymphatic system. Now, muscle contractions are good for your lymphatic system because remember, you got your skin, your interstitium, and then your muscle. And remember, the lymphatic system is in between the muscle and the interstitium. So when you are pumping, contract, relax, whether it's walking, moving your muscles in your arm, you are compressing the lymphatic system and moving the fluid along the lymphatic system. So that's why that muscle pump and movement of the body part is really good. There is so much lymphatic system in the chest wall that when you inhale and exhale deeply, when you're breathing heavily, you are creating a suction effect on the lymphatic system and moving lymphatic fluid. So when you are taking a walk, you are moving lymphatic fluid. And remember, the interstitium is really, really small. So your capillaries are also in the interstitium. And when you are exercising, you can kind of feel your heart pounding in your arms and in your legs and in your neck. When you hear those little capillaries that are pulsing because you're working a little bit harder, when they pulse, they literally bump into these lymphatic vessels and they open and close and increase fluid. So that is why exercise is so good and movement is so good for your lymphatic system. So this is why, when I showed you this picture, this is why this being all stretched out, this being fully mobile at the shoulder joint, the skin moves good, the muscles move good, the shoulder moves good. That's why it's so important to have that in decreasing your lymphedema risk. So we want to stretch out the skin, the muscle, and the scar tissue. We want to make sure that the mobility of the skin and the muscles, so just not only is your shoulder joint moving well, but the skin moves well and it moves nice and long. We want to make sure that the strength is normal in that shoulder, in that area, because if you have normal strength, you're going to move it more. If it's normalized to strength, it's not going to hurt you very much. If it doesn't hurt, you're going to move it more. And again, there is evidence that as long as you introduce your arm to general activity again, that rowing, biking, shoveling, lifting weights, flipping a gymnast or whatever it is that you do does not increase your risk. Matter of fact, it decreases risk by engaging in regular exercise. So when we talk about myths, this is one of the biggest ones that we've been able to bust. Okay, any questions so far? Otherwise, we'll go on to our myths.
There are a couple, but do you want to just finish up and answer them or do them now?
Yeah, let's hold up because they'll be good for the end.
Perfect.
So I will do our myths. We're getting close to being done here. So everybody's doing great. Thank you. Okay, so back in the day, and depending where you live in the country or if you live outside the United States. Some of these myths will still be around. Some of them will be completely gone. Some of them you may have never heard of. All right. But the old traditional lymphedema precautions were developed in the 50s and 60s and 70s when the surgeries were very different. Okay. And they weren't based on research. They were generally based on conventional wisdom. Well, okay, if we don't want your arm swelled, don't use it. Don't push, don't pull, don't lift, don't carry, don't do anything that we think might affect the lymphatic system. So that's how most of those precautions were developed, never based on any research. But over the years, we said, the people that fly and the people that don't fly have the same lymphedema risk. The people that exercise or the people that sit on the couch don't have any less lymphedema than the people that are active. So we know that doesn't protect you. So over the years, we're starting to now really look at these precautions really don't belong in medical care anymore because they aren't evidence-based and they don't help you. All right. So repetitive activity is not only not safe, it is good for you. And we now know why, because it moves lymphatic fluid. So lifting weights is safe. Okay. If you are more worried about you tearing your rotator cuff by doing too much too soon than it creating any swelling problems. And as a matter of fact, for people that have lymphedema, one of the first treatment tools we will use is exercise and lifting weights. Okay. Because we know that muscle contractions are actually good for the lymphatic system. So we do want you exercising. There is no evidence that air travel causes lymphedema. Okay. There is also no evidence that wearing a sleeve will prevent lymphedema. So most places around the Midwest now have never, for 25, 30 years, have not told people to put a sleeve on when you fly. But I still hear that coming from outside the region. So I would strongly say do not put a sleeve on if you don't have lymphedema, because when they did the studies, people that put it on prophylactically to prevent lymphedema, there was a significant amount, I think like 18% actually developed hand swelling from wearing the sleeve. So we do not recommend, if you do not have lymphedema, that you do not put a sleeve on your arm to exercise or if you fly. When sentinel node biopsy came out in the early 2000s, a lot of people said, oh, there's not going to be any more lymphedema. Well, so there is a lot less lymphedema than there was, but a sentinel lymph node biopsy, even one lymph node, the risk is low, but it is still there. Now, the big one that I think surprises most people is there is no evidence that blood pressures or blood draws on an involved arm increases your risk of developing lymphedema. So I'm going to say that again. There's no evidence that taking a blood pressure or having a blood draw on an involved arm increases your risk of getting lymphedema. So my caveat to that is this is always your choice and always comes down to a discussion between you and your surgeon, because you and your surgeons are the ones that know your armpit the best. If you want to continue to use your other arm, that's absolutely fine. But just know that there is no reason that you can't use your involved arm. That this does not apply to people that have lymphedema. This is just people that are at risk. And for many of you, your involved arm may have spectacularly beautiful veins, and your non-involved arm has probably been trashed over the years because of all the blood draws they've been doing on that side. So sometimes people their veins are gone in their non-involved arm. So sometimes this can really, really make a big difference. All right. And then I just want to wrap up with keeping an eye on your physical health, because again, if any of you have followed me or see me on the recovery room, you always hear me say exercise like your life depends on it, because it does. All right. And that is because it decreases risk of lymphedema. It decreases risk of cancer, breast cancer recurrence. It decreases the risk of dying from breast cancer. It decreases the risk of dying from other crap that breast cancer survivors tend to die of. So exercise is crucially important. So I want to just really quickly go over, well, when you say exercise, what do you mean? The research says breast cancer survivors should be doing 150 to 300 minutes per week of exercise. And that is a combination of aerobic, which can be walking, cycling, swimming, dancing, walking around your living room, anything that is sustained for a period of time. And then we want you to do that most days of the week. So 5 to 6 days a week, you should be doing some kind of walking or aerobic exercise. And then twice a week, I take this back, it should say twice a week. We want you to do exercises that strengthen your legs and strengthen your arms. So super easy thing to do is just sit to stand from a chair 10 to 30 times, or do 10 to 30 push-ups against the wall. Those are great ways to keep your arms and your legs strong. Now, yes, 150 minutes is 2.5 hours to 5 hours a week. That is a lot of time. However, there are 10,080 minutes in a week. You can find 150 minutes to do your exercise. Okay. And again, if you can't do 150, then you do what you can, because something is always better than nothing. And yes, that's a lot of time, but you did not have time to have surgery. You did not have time to have chemotherapy or radiation. Remember how much time that took out of your life, away from your family, away from your work, away from your home, away from your yard, away from your pets. But you did it because your life depended on it. You have got to see exercise in the exact same way, because your life, the quality of your life and the length of your life literally do depend on it. So people will say, well, how much weight am I supposed to use when I lift weights? I say follow the 10 to 30 rule. Okay. So if you pick up a weight or you put a pin in a machine, you should be able to do about 10 repetitions. Okay. If you can't do 10 in a row, it's probably a little bit too heavy for you. All right. And on the flip side of the scale, if you're ripping off, 25, 29, 30 repetitions without feeling a lot of muscle tiredness, it's probably not enough. So stay somewhere between that 10 and 30 repetitions is usually a nice, fun, safe way to judge how much you should be lifting. Okay. Again, you want to do exercises for your heart and your lungs, as well as your arms and your legs. And again, anything is better than nothing. So do what you can and build from there. All right, very quickly before we wrap to questions, please, I do have a ton of free resources available to you. The Recovery Room is found on both Facebook and YouTube. If you type The Recovery Room into the search engine, there are 150 videos there. They're about 4 minutes long. They're short, they're medically accurate, they're easy to understand, and hopefully they're kind of fun on all sorts of topics related to cancer and cancer recovery. And then excitingly, just last month, I launched the Recovery Room podcast. And here are the topics of the first 10 episodes that have come out to date. And if you are a person that likes to watch your video podcast, you can actually see me and my guest. You need to go to YouTube for that. And again, you just type in The Recovery Room, and across the top, it'll say shorts, playlists, videos, and it'll say podcasts. And click on that, and it'll take you to the video podcast section. And if you're somebody who just likes to listen, you can find that on YouTube as well, but that's also wherever you find your podcasts, Spotify, Apple, iHeart, etc. It's there. So would love to have you listen. And please, I always want to know this stuff is for you. So I always want to know, what do you want to hear about and who do you want to hear from? All right, because that's why we're doing them. Okay, I would love to answer questions for you now. So Amanda, do you have a couple more of those questions ready?
Oh yeah. Wasn't sure if you want me to, let me get back where they were. I'm sorry. All right, so this one says, should we pump and or exercise the arms every morning? She already has lymphedema.
There's no reason not to. I would have you talk with your particular physical therapist about what is best for your arm. What I'm going to say is, if you are doing something that immediately looks like it helps your arm, then continue to do it. Yes, you should be exercising regularly, but as far as the compression pump goes, if you take your arm, it's going to be lumpy when you take your arm out. But if it looks better or feels better, then you can use it. If you're like, I'm just doing this because somebody told me to, and it looks exactly the same, and I've been doing it for months, then maybe it's not a tool that's going to be helpful to you. So again, that's going to be a conversation between you and your particular physical therapist.
Perfect. This one says, I was told that my risk of lymphedema is very rare because I only had a few lymph nodes taken out. Is that true? And what percentage of breast cancer survivors get lymphedema?
Again, if I understand correctly, if people who have just 1 or 2, 3 lymph nodes removed, okay, lymphedema risk is still there. It's small. It's around 5 to 6% of people that have only 1, 2, or 3 lymph nodes removed get lymphedema. Okay. People that have had a full axillary dissection, again, 12 nodes, 15 nodes, 25 nodes, somewhere in that zone, their risk is about 15%. And then if you throw radiation on top of that, it can go up to 20%.
Got it. This one says, I am working with an OTPT under my arm for lymphedema from removal of 5 nodes. I had breast cancer and also had 30 rounds of radiation. They are doing a great job to help me, and on my left ankle, it has become puffy. Nodes taken from right armpit. Is this normal? Is it not a heart issue? Oh, it says it is not a heart issue. Sorry.
Okay. So correct. If you have lymph nodes removed from your right or left underarm, it cannot cause swelling in your ankles or your legs. Now, and again, I have no idea what your treatment plan is. Some of the taxanes, Taxotere, Taxol can cause kind of systemic swelling all over the place, but that would be in both legs if it was related to your chemotherapy. So I would talk to your primary care physician and find out, or your PTOT, and find out, okay, why is your ankle swollen? But it is not related to your radiation or to your lymph node removal.
Okay. The next one says, I use a compression sleeve almost 2 years later during lifting weights. When do I discontinue their use?
You can discontinue it now. It's not really doing anything for you. There's no evidence that it's preventing anything or helping you. And there's no evidence that lifting weights is going to create a problem. Matter of fact, what you're doing is awesome. You just don't necessarily need to do it in a sleeve.
Okay. This one says, 10 years ago, I was told no injections, blood pressure cuff, or tourniquet. My oncologist recently said injections are okay. Have the recommendations changed?
They have. Yep. And that's where this myth busting part came in. So the evidence now, and again, depends on where you are in the country, how quickly it's rolling out. If you are here in the Midwest, we are now have removed all of those precautions, like don't get blood pressures, don't get needle sticks. Those are all taken off of our precautions list because there's no evidence that those can increase risk. So that is correct. Your physician is correct.
Okay. This one says, I currently have lymphedema in my breast. My PT gave me massages to do. Is there anything else I can do?
Again, the risk or the evidence that self-massage is going to reduce risk is minimal to none. Okay. If you have a lot of scar tissue or fibrosis, that needs to be worked on. But if your skin is healthy, adding massage is not necessarily going to decrease your risk. What will decrease risk is going for a walk, lifting weights, making sure that you're doing regular exercise, making sure that you're minimizing your risk of infection and keeping your body weight, body mass index in a kind of the best zone for you. That's the best things you can do.
Okay. This one says, I have just had a flare-up of my lymphedema and am resuming therapy. The only recent change in routine was joining a circuit training program that included weight machines for arms and shoulders. Although weight training in general doesn't cause flare-ups, can overexertion have triggered the recurrence?
That's hard to tell. I think what's going to answer that question for you is I would encourage you to, and again, you need to talk to your therapist, but I would encourage you to continue lifting weights. And you're going to find out if you do something once, and then typically if you're going to do something that's going to make your lymphatic system mad, it's going to happen within hours. So within 6 hours. So if you strained yourself on Monday and your swelling happened on Thursday, probably not related to the activity. So I don't know what your timeline was. But what I would do is encourage you to continue to lift weights. And then if you notice that every time you do something in particular, that it makes your arm a little puffier, then you can decide, well, no, it's worth it for me to do that. And it makes it puffier for a while and then it comes back down. That's okay. But you're like, no, I really don't like that. It stays swollen for a long time. It's uncomfortable. Then you can choose to do that, to not do that, or do something differently.
Got it. This one says, is there a virtual lymphedema support group that anyone could recommend?
Ooh, that's a good question. I don't know, but throw your recommendations into the chat. What I get a little concerned of in those groups, though, is that there's a lot of misinformation. But for people living with lymphedema, connecting with other people that live with lymphedema is a good thing. But just be careful that it's evidence-based group.
Okay. This one says, can you talk about truncal lymphedema? Should we be wearing a compression tank top? Are there different risk factors for this area?
They're about the same. Now, truncal lymphedema is more surgical, post-surgical related, harder to get rid of, harder to prevent. So post-surgically, if your surgeon says, hey, wear this compression vest for 3 or 4 weeks, that's a good idea. But wearing that continuously to prevent, I don't know that there's any evidence for that. And then for people that have edema, truncal edema, then your answer is going to come not from your therapist, but it's going to come from what you do. So if you wear a trunk compression, it's like, oh my God, this is great, then I want you to keep doing it. But if you're like, I've been wearing this compression for months and it makes no difference, then maybe you don't need to do that. So again, that's again, I can't see your faces. I can't talk to you one-on-one. So that depends on several things, but I'm hoping that helps you with your question.
Okay. This one says, I already have lymphedema. Can I use that arm for blood pressure and draws?
I'm sorry, you cut out a minute. Can you say that again?
Oh, it says, I already have lymphedema. Can I use that arm for blood pressure and draws?
At this point, we're saying we'd rather you not. The chances are you're going to be fine. But for people that have lymphedema, the evidence is still leaning on the side of, it just do it on the other side if you can. Again, does it increase risk of infection since you already have edema in there? So for people with lymphedema, we're still saying if you can, use the other arm.
Got it. And then this one says, should injections be avoided on the side where surgery was done?
We've learned that we don't need to avoid needle sticks in an involved limb. So you can use that arm for needle sticks without increasing your risk of lymphedema.
Okay. This one says, regarding sleeve, my 80-year-old dad has breast cancer and had lymph nodes removed. We gave him a non-compression sleeve to protect him when he is working on the farm. Is it only compression sleeves that causes swelling in the hand, or any type of sleeve?
If it's nice and loose and it's not bothering him, and he's active, that's absolutely fine. Not a problem. If it's something that's super, super tight, I'd be a little nervous, but if he's been using it and it protects his skin, that's brilliant.
Okay. This one says, I have osteopenia in my radius. If it has progressed to osteoporosis, would this count as an injury that could have aggravated lymphedema?
Unlikely. Very, very unlikely.
Okay. This one says, do you recommend not lifting heavy, can't do 10 reps with them? Which I think you can answer that.
It's not, yeah, I typically say when you're lifting something, I would like you to be able to do 10 repetitions. Again, I'm worried about rotator cuff strain or muscle strain or a tearing of a tendon more than I am of you creating a lymphedema. So if you start lifting weights and you're lifting something really heavy, I'm worried about you getting injured. So that's why we just say, if you pick something up, I'd like you to be able to do 10 repetitions. That's a good start. Okay. If you can't do 10, it might just be a little bit too heavy for you right now.
Okay, lots of thank yous, lots of great information, a ton of those. This one says, you are still awesome, Leslie. I worked with you 20 plus years ago and believe basically you were the reason for how she recovered so well. So I didn't want to
That's awesome. Hey, Michelle.
I didn't want to overlook that one. This one
That's
says,
awesome. That's the great thing about being old and in the business is I've literally known people for 20, 25 years. It's awesome.
This one says, I have lymphedema. Can I get a regular massage or do I need to get a person who specializes in that kind of massage?
Any massage is absolutely fine. Absolutely. It always comes down to, you know, if you like your massage therapist, there's no reason you need to get you're not broken, right? So you can go to any kind of massage therapist as long as they're comfortable with you. You don't need any special massage. They're not going to make it better. They're not going to make it worse.
Okay. This one says, is wearing a watch on the affected arm allowed?
Absolutely.
Okay.
Yep. Yeah, you don't want it super, super tight. Like you don't want it to create a tourniquet, which I'm assuming you're not doing because nobody would intentionally do that. But yeah, there's no evidence that wearing jewelry increases your risk.
Okay. This one says, can you explain cording, please?
Okay, that's going to take a bit, so I'll give you the 15-second version. Cording is an inflammation of the lymphatic system that is not lymphedema. And you can actually, and it happens post-operatively, so it's a post-operative condition. You can actually see or feel cords either in your armpit or running down your arm. That's cording. And because this isn't really a cording conversation, I'm not going to go any more to it, but that's what that is. And it does eventually go away. And if you have it, I would go see your PT.
Okay. This one says, can the surgery side arm be used for IVs?
Yes.
Can jumping on a trampoline be bad or spread cancer through your lymphatic system?
It cannot. It
Okay.
cannot. Yeah, massage doesn't spread cancer. Exercise doesn't spread cancer. Repetitive activity doesn't spread cancer.
All right. This one says, during the pandemic, it was discovered that the COVID vaccine caused swelling and unnecessary diagnostics. Should these vaccinations be avoided in the involved arm?
There is no evidence of that. Now, what's happening is, and this always happens with vaccines, we just didn't know it before because we weren't looking at the armpit like we are now, is that's your immune system in play, right? It's creating a reaction to this vaccine that can make lymph nodes in your axilla swell up a little bit. And that happens, I can't remember, it's maybe 10% of people that happens to. So that's why they always say get your mammogram first and then have your COVID vaccines so it doesn't mess up your lymph nodes, because once they see a lymph node, they have to go look at it. So but there is no evidence that increases risk for lymphedema. Great question.
That is all the questions. You can read all the people saying how awesome you are in the comments.
And I loved where everybody's from. We are all from all over the place.
So I wrote down, and we have a couple in Washington, South Carolina, Florida, LA. We have someone in Canada, plenty in Wisconsin. We are all over tonight.
Desiree, my girl in Miami. I love Miami. I get there at least twice a year.
And thank you so much, Dr. Leslie. Thank you, Amanda, for coordinating and reading off all the questions and all the thank you. There's just so many comments in the chat thanking you. I just wanted to run a couple of our upcoming events. As you can see, we're celebrating our 25th anniversary. It's coming up on June 15th, and you can find more information about that on our website, as well as the other upcoming events that we have. Our next LEAP series will be July 16th, and you will be able to see and sign up for that on our ABCD website. This last slide coming up, if you want to take a moment to scan the QR code so that we can have feedback, we will also put in the chat our survey link, and then we'll also email it out to you. So we'd love to have your feedback. There's an opportunity on the survey for you to suggest any topics that you would like to hear about for us to present. So we just thank you for joining us. We want to be respectful of your time and have a great evening.